Today's topic is about placenta previa and low-lying placenta. I always get people asking me this question. Doctor, the common questions that I get is like, Doctor, I went to Clinic Kesihatan that day and the doctor in the Clinic Kesihatan told me that my placenta is low and I'm now a bit worried. So they always ask me this question, especially even with many of these mothers who have been seeing me like every month, and then we do the placenta is okay, but then when they went to Clinic Kesihatan, you know, Clinic Kesihatan don't scan every month. They scan once in a while, and then the doctor say that the placenta is low, and then they get very worried. Sometimes they don't even wait for their next appointment. They just come another day, the next day, to come and see me just to reconfirm whether the placenta previa is the placenta is really low or not. Of course, there's another common question is that people ask me, my placenta is very low, can I have natural birth? Somebody told me that I need to go for Caesar, and then you know there are a lot of people who do not want Caesar, so they're very worried about the placenta being low. So today I'm going to describe a bit about placenta previa or low-lying placenta. Why do we call it low-lying placenta, and why do we call it placenta previa? Is it the same or not the same? Actually, it's not exactly the same because the definition is very clear. The key word is 28 weeks. 28 weeks. Anything before 28 weeks, we call low-lying placenta. Anything after 28 weeks, we call placenta previa. So why there's two different names? It may mean almost the same thing, but why there's two different names? So first thing, you need to understand how this thing comes about. You must understand in the very beginning of pregnancy, especially the first 12 to 14 weeks, actually the placenta is usually almost covering the entire area. Not the entire area, but almost the entire area. So very often it's quite low down also because it's covering the entire area, the entire sac almost. So we get a lot of very low-lying placenta in very early pregnancy. Because the placenta the sac is still so small, because it's so small, so the placenta almost covered the entire sac already. So you get low-lying placenta in almost everyone in the early pregnancy. But as the pregnancy grow, as the sac grow, as the uterus grow, then the placenta will start to cover only a certain percentage of the entire sac. Eventually, it only cover about 30 to 40% of the entire sac. So as things grow, things start to change. So we always say placenta start to move up, or in simple word, placenta migration. So when placenta start to move up, slowly, it will go higher and higher and higher. And how, until when will it go up? Till the end of the pregnancy. Even at 36 weeks, 37 weeks, 38 weeks, it can still go up. It keeps going up until the end of the pregnancy. Then why is 28 weeks so special? It's because in the 28th week onwards, after 28 weeks, the lower part, we call the lower segment of the placenta, the lower segment of the placenta start to form. That is the word we use, formation of the lower segment of the placenta, and therefore a lot of placentas will actually move up after the 28 weeks. So before the 28 weeks, sometimes you see the movement is very little, but after the 28 weeks, they actually move a lot faster. It's because the lower part of the uterus, the lower segment of the uterus forms faster, that means grows faster, broaden faster after the 28 weeks. So a lot of placenta after 28 weeks, even if they are low-lying before that, after 28 weeks, they usually go up. So when after 28 weeks, if your placenta is still low-lying, that is when we call it as placenta previa. But this placenta previa doesn't mean that if you have placenta previa at 28 weeks or 38 weeks, that the placenta will remain placenta previa at 36 weeks, 37 weeks. No, it will keep going up. That's why in typically, like, I still remember when we work in government hospital. In government hospital, whenever we diagnose the placenta previa, we will tell the mother, you need to admit to hospital. You cannot stay at home anymore. You have to stay in hospital all the way until you give birth. It's very sad to hear that, but actually this bunch of women, they all just make friends with each other because all of them will stay in the hospital for many months. And then they make friends with each other, and then they start doing things together. They do a lot of handwork, craft work. It's quite interesting to see all these mothers in the ward. But what happens when they're in the ward? they will actually be asked to go for ultrasound scan every 2 weeks. Why every 2 weeks go and ultrasound scan again and again and again? Because we know the placenta can still go up. So every 2 weeks they scan and scan and scan, and then they go for the scan. All they are praying for one thing only. They pray that the placenta go up so that they can go home. You see, when we scan, placenta go up, I can go home. So you see, even if your placenta is low, it is not forever. It's just temporary. In most cases, it is temporary, but in some cases, it may be forever. So some go up, some don't go up. If you are lucky, your placenta go up, then you can go home. Then you don't need to stay in hospital anymore. So why some placenta go up and some placenta don't go up? Actually, all depends on where the placenta is. So for example, like this is the hole, this is the outlet. Why we worry about placenta previa is that if your placenta is covering the outlet, if the outlet open during childbirth, what is going to come out? The thing that's going to come out is the placenta. So if the placenta is going to come out, it's going to bleed so much. That is why we keep the mothers in the hospital. That's why we don't let them go home. So this is commonly practiced in government hospital. Maybe in private, not all the time they keep them in the hospital, but in government, we usually keep them in the hospital. Okay, so if the placenta come out when the passage open, they will bleed so much. So what happens is that and placenta we have many types. We can have placenta type 1, 2, 3, 4. Why 1, 2, 3, 4? Oh, very easy. If this is a passage, if the placenta is only near the passage, this is the outlet, but it's somewhere here, it's type 1. If it goes until here, it's type 2. It touches the passage outlet, it's type 2. When it covers the passage outlet, it's type 3. If it the center of the placenta now totally cover the entire placenta, entire outlet, type 4. So it depends on where your placenta. Then we have different type. So we have type 1, type 2, type 3, type 4. So type 4 placentas are unlikely to go up. Because even if this part of the uterus goes up, this part of the uterus goes up, the center is still in the center, so they forever remain type 4. In type 3, some may slowly become type 2. In type 2, will slowly become type 1. In type 1, it can come up further and totally no placenta previa. So the thing is it all placenta previa have to have Caesar? Is it all placenta previa need to have Caesar? The answer is also no. Okay, let's imagine again. We know that the placenta, the passage will open. Passage will open, right? Slowly, open slowly. So open slowly. If the placenta is in the middle, then they bleed, right? So sometimes you understand that the placenta, as it opens from 0, 1, 2, 3 until 10 centimeter. Sometimes when it opens until 10 centimeter, there's a placenta here. Little bit here lah. Not totally covered. Totally covered, you definitely cannot. You have to go for Caesar. But maybe a bit here. So most of the type 1 placenta previa, they can still try natural birth if they want. Because the placenta is only here. Initially, when it open, the placenta is still not in the hole, so it's still safe. The mother will not bleed. When it open big enough, it may start to enter the hole in the outlet. But at the same time, the baby head also there, compressing on the placenta, so it doesn't let the placenta bleed. Then actually the mother still can have natural birth one. So, as most of you know, I tend to encourage natural birth. So I do not tell all my placenta previa that you must have Caesar. So usually we will keep and watch and see. There are many things you need to do, like what I always explain in my book. Have you read my book? As I always say in my book, you want to have natural birth, you need to use your brains a bit, man. You cannot just follow strict SOP. If you follow strict SOP, it's very simple. Placenta previa equals Caesar. No need to think already. But if you want to have natural birth, you have to use your brain a bit. So that's why when we know type 1, if the baby's head can compress on the placenta, it's still safe. The mother will not bleed. So how to make sure that the baby's head compress on the placenta? There are ways. Normally, we have to make sure that the contraction is strong enough to push the head down to compress on the placenta. So if the contraction is strong enough, presses on the placenta, doesn't bleed, mother can still go for natural birth. And some of them, maybe type 1, type 2 like that. Of course, type 3, type 4, we don't need to think lah. Especially you already reached like 35, 36 weeks, 37 weeks. If you're type 3 or 4, normally we do not need to think anymore. Most likely it will not go up because we need to Caesar you anyway by 38 liters. But if you're talking about those type 1, type 2, sometimes we can still look at, other than how near it is to the opening, we also can look at the cervical length. So if you have read my book, you will know what it means by cervical length. Because the cervical length, if you do an ultrasound scan of cervical length, we can roughly predict how long more will you give birth. How long more? So if let's say your cervical length is so long, yes, your previa type 1 to 2, but your cervical length is so long, so actually you can still wait. Chill, wait for the cervical length to thin down and see where's your placenta, and then only decide whether you really have no choice or you still have a choice. But all these things at the end of the day also very much depend on the doctor. And there's another thing about placenta previa. If somebody says you have placenta previa, the first thing you need to do is to get somebody else to scan for you. Because this previa thing, that's why even in government hospital, you have seen some mothers, today they come in because of placenta previa. But as I said, every 2 weeks we will repeat, right? Actually, we repeat not 2 weeks after you admit. There's a fixed day that everybody goes to the ultrasound room and gets a scan done to see if it's still previa or not. So some mothers maybe only come in 1 week ago, and then 1 week later is the time to do placenta previa scan for everyone. So they follow everybody and go and scan, and then you see, no previa, go home. 1 week only. Is it possible? One of the reasons, of course it's possible, but another reason is sometimes placenta previa, you need to scan by few person to confirm the exact location. Different machine, different hand, different angle, different situation, like where is your baby's head, and also different method of scanning can give you different result. For example, do you scan from the tummy or you scan from vagina? Given different result. Is the baby head down or the baby head is up? Different result. So it doesn't matter which one. If they have many different results, the one that usually more accurate, I would say, the one that scan from below, vagina scan, and the baby's head is not there. When the baby's head is not there and it's a vagina scan, that is the most accurate. So sometimes you just need to get a scan again. That's why a lot of my mothers, they are smart lah. Clinic Kesihatan ask them to scan, say they got placenta previa, they will quickly come to my clinic and get a second opinion, because maybe your Clinic Kesihatan is wrong. So you want to double confirm. But if you double, triple confirm and still everybody say the same thing, that you have placenta previa, then it's previa lor. So placenta previa is one thing that wise to get a second opinion, because depends on where the baby location, baby's head position, and whether you're scanning from above or below, actually does give you a different answer. And so if one person say you're previa, doesn't mean that everyone is going to say you're previa. So that's why it's very important to get a second and third scan. Okay? Does placenta previa have any risk upon the last trimester? Only when you go into labor, that's all. Because why? Because when your passage open, the placenta comes out. It's at the passage. It is out here. This placenta is full of blood. So if the placenta comes out at the passage, that is when it bleeds. And bleeding can be quite scary, honestly, because you can bleed so much in such a short period of time, because placenta is nothing but blood. So that is why, especially in government hospital, we tend to keep mothers in the hospital, because in government hospital it's a different situation. Not all have a car or a transport that can send them to the hospital immediately. A lot of the mothers that go to a government hospital may stay in some kampung, and to get to the hospital it may take hours to reach. So that is why it's safer to keep them in the hospital. Although they are sad to be in the hospital away from their homes and their family, but we don't really have a choice. But in private, sometimes we have to look at the situation, because some of you will have car access at any time, or stay very near the hospital, can reach the hospital very fast. So sometimes in these type of cases, we do allow some placenta previa to stay at home, but maybe not the previa like type 4. But type 4, if towards the end, it's still better to be in the hospital. Okay, so it all depends on the situation. What type of placenta do you have? And another thing is your passage, your cervical length, how thick or thin it is, roughly to estimate roughly when you're going to give birth and when the passage is going to open, and how far you stay from the hospital, and whether any transportation to send you to the hospital as soon as possible if in case you bleed. So these are the things that we look at, especially in private hospital, because asking you to stay for 2 months or 3 months in the hospital is going to cost a lot. So we don't usually force everyone to stay in the hospital. Placenta previa, can it be prevented? Unfortunately, no lor. The only way to prevent placenta previa is not to get pregnant. So no, it cannot be prevented. So there's nothing we can do. Actually, honestly, placenta previa is the only reason for cesarean that we can't do anything. Other than the fact that some type 1, type 2, maybe you can try natural birth. Type 3, type 4, there's really nothing you can do. So you can't prevent, you can't predict. As most of you know that I encourage natural birth. In almost every situation, there are ways you can prevent a cesarean, but in placenta previa, there's nothing you can do. What is the main factor that causes placenta previa other than previous scarring at uterus? As you know, previous scar, that means if you have a previous surgery, it doesn't matter whether it's a previous cesarean, a previous surgery for fibroids, a previous DNC, there is a slight increased risk of placenta previa. Reason is because of the scarring. Areas that are scarred is usually deprived of blood vessels and healthy tissue. So the area there's no healthy tissue. So if the placenta happened to be there, because as I say in the early pregnancy, placenta almost cover the whole sac. So if the placenta happened to be there, and because there's no nutrient there to collect from that spot, so the placenta actually grows roots that are deeper. How would we describe? It's like a cactus tree, you know, a cactus in a desert will grow roots that are so deep to get the water, right? To get the nutrients. So same with the placenta. So if you have scarring in your uterus, the placenta will grow roots that are so deep to try and get nutrient, and then when it grows roots that are deeper, it's less likely to be able to move up, and that's why you end up with previa. Actually, other than scarring, there's no major other issues, reasons other than if you have a previous placenta previa, you tend to have another previa. Of course, we say older age group people tend to have more previa. The more kids you have also tend to have more previa. But there is no real reason for why it happens in this group of people. So in most situations, we actually do not know why you have previa. So I always tell patients, it's actually luck. It's really luck. The placenta decided to stay there, there's nothing we can do. So, and if it stays there, then we have nothing we can do, and then we have no choice but to have a cesarean. On the topic of placenta previa, actually there are also many types of previa other than type 1, 2, 3, 4. There is also the degree, whether it is deeply rooted. So we have placenta accreta, percreta, increta. These are abnormal types of placenta previa. I think I have a video on that. So if you want to know more, you can go to my YouTube channel and look at the video on placenta accreta, which is an abnormal type of placenta. There is also a situation sometimes we can predict is when we look at if you have a previous Caesar. If you have a previous Caesar, you can also look for your integrity of your scar, integrity of your Caesar scar. So there's a situation we call isthmocele. Isthmocele is again a topic that I have already had a video. So if you want to know more about isthmocele, you can go to my YouTube channel and browse through isthmocele. But isthmocele is a situation where we can see on ultrasound scan that your previous scar, the integrity is not so good. And we know that once your integrity is not so good, then the chances of placenta previa actually increases. So in some cases, we can actually predict, but not all. But it only increases, it's not 100% that you will get placenta previa. Okay, it's not 100%, but definitely the chances increases because the integrity of the scar is not there. That particular area definitely have no nutrients to give the baby at all. Does it mean we can try natural birth if you have type 1 or type 2 low-lying placenta? I'm currently 28 weeks and my placenta still at type 2, more to 3 at 26 weeks. Yes, type 1 to 2, we can still try natural birth. It's not a must to have Caesar. It's not wrong to Caesar, but you can still have natural birth, provided, I told you the condition, you must have contractions that are strong enough to compress on the placenta, so which is possible. But type 2 can be a bit tricky. So if type 2, normally I will look at the cervical length and see if I can give you time some more for the placenta to go up to become type 1. But type 1, in many situations, we can still go for natural birth. Normally, we also look at whether the placenta is in front or behind. There is this general rule, but it's not a must, but a general rule we always say among us is like, if the placenta is in front of the uterus, in type 1, then you can go for natural birth. If it's behind the uterus, even up to type 2, you can still go for natural birth. So that is why we actually look at where the placenta is. And but this is just a general rule. More often than not, we actually look at the whole situation. So number one, the criteria is if the passage were to open and the placenta were to be partly inside the passage, the baby's head must be able to compress on it so well that you do not have any bleeding, and that is the criteria. So that's why that is the general principle to see whether we can allow a mother to have natural birth or not if got placenta previa. But type 3 and 4, definitely there's no way. In fact, I will tell mothers, don't worry lah, there's nothing you can do, right? You worry also can't do anything. The placenta is not going to go up just because you worry or you do something, it's not going to go up. So at the end of the day, just chill and wait for the placenta to go up. Placenta need time to go up. So once it reaches like 36, 37 weeks, then only we start thinking, where's the placenta now? How long do you more before you can give birth? Do you have enough time for the placenta to go up some more or no more? Then, or if it's type 4, there's no way it can go up. So then just forget about it, just go for the Caesar. So for all of you who have not subscribed to my YouTube channel, please subscribe to Dr. Tan's City Clinic and please turn on the notification button so that you can be notified when there's new videos, and also please like my videos, yeah? Okay, so that's all for today. Stay tuned again next week, same day, same time. Bye bye.